You know, my dad used to tell me as a young girl, Kristina, don't let anybody rent a room in your head for free.
Okay.
He used to tell me that all the time.
Mm-hmm.
Kristina, don't let anybody rent a room in your head. Meaning, don't let anybody occupy or take away from the space and the peace of mind that you need.
Yes.
Because at the end of the day, people need to do what's best for them.
Right.
So I'm going to do what's best for me.
This is Tori Kristina, and welcome to Sit With Me, where I am here to introduce us to the ideas and people that will help us get healthier together. Today, our guest is Kristina Lindo. Hi, Kristina.
Hello.
And actually, let me correct that. That's not just Kristina Lindo. That is Dr. Kristina Lindo. Yes, ma'am?
Yes, ma'am. Praise God. Won't he do it?
Yes, he will.
It's because of the Lord.
I've been so blessed to be able to interview people at your level, especially in education, that have taken those extra steps to get to where you are. So I honor you today, Dr. Kristina Lindo.
Thank you.
Yes. And so we're going to get right into it. Now, we know that on these segments of Sit With Me, we're talking about mental health. What is your stance on mental health and prescription drugs?
My stance on prescription drugs and mental health is that I feel that prescriptions have their place, because I feel like chemically there are people who walk this earth who are not leveled at the right levels in their brain that modulate different mental disorders and diseases. But as a whole, being a pharmacist now for almost 8 years, practice as a pharmacist, and being in the realm of pharmacy for over 16 years, I feel like prescriptions are being misused and overused in mental health.
Okay. Misused and overused. So, but you do acknowledge, and this is a point that I like to bring up, especially within the kingdom and the body of Christ, that sometimes chemically our bodies need additional things or things taken out in order for us to operate properly. Is that correct?
That is correct. There's certain chemicals that function in the body that if one is higher than the other, it can manifest into a schizophrenia, bipolar. And then if another level is lower, then that will manifest into depression, where people are sad and gloomy and lost interest in a lot of the things that they used to. But the good thing about it is, if we are Christians and spiritually minded, that's not the end result for us. That there is a hope, and that hope is in Jesus if we truly trust in him.
Right. So yeah, I always tell people, like, I do believe in the supernatural power of God, and we know that he can do all things. But we also want to acknowledge that God has given us the wisdom and the knowledge to be able to create these things that work with the human side of us. Right. So when you say that sometimes, what did you say? That they're overly prescribing?
Well, when I say overprescribing, and I just want to make this known that today, although I'm Dr. Kristina Lindo, I'm not in my white coat and I'm not in a clinical formality, meaning I'm not in a clinical setting. I'm sitting with Tori today.
Sit with me.
So a lot of what I will say today, I want to put as a disclaimer, is coming from my level of experience while I'm integrating my faith on this show today.
Awesome.
And I want to be real, because there's times where we need to be more predominant with our clinical and say, this is what the clinical guidelines say, and this dose is for this person. But being actually in the community and being a community pharmacist, working in a local drugstore for over 16 years, I have seen that one pill may do for you great wonders, but that same exact dose may do completely the opposite for someone.
Right.
So we have to make sure that we are not treating people as a number, and that this is patient 103 in room 251, or this is patient's prescription number 16 for today. But we're treating you as a whole and looking at you as a holistic person, saying, wait a minute, you might have certain allergies, or you might be breastfeeding right now, or you might be trying to become pregnant, that this will make you not the best candidate for this medicine.
Right.
And we have to take that into a whole, because when we don't, then we start running into these errors of, oh my God, I'm taking this medicine, but it's actually, wait a minute, my hair is falling out.
Right.
Or I'm taking this medicine and all of a sudden, if I'm married, my sex drive is dropping. So we have to make sure that, and it only comes with experience. So that's why I wanted to put this disclaimer out, that I'm not talking straight from, my research and
Just
guidelines. I didn't even show up here with no books. I'm coming here to flow organically from a place of experience and being led by the Holy Spirit on how to handle people and treat people, not from just a perspective of, okay, you take Zoloft and this 100 milligrams or this 10 milligrams is going to be the starting dose for you, you, and you. But no, really get to know a person and understand their entire life and their day to determine what's best for them. Because if not, then we start running into this domino effect of overprescribing and overtaking unnecessary medications.
Right. That could lead into other problems. Like we see on the commercial where they have all the side effects.
Right.
And you be like, oh, well, I might as well just stick with my issue.
And I'm not trying to negate the fact for medications, because God blessed me so I can acquire a doctorate degree in pharmacy. But I will say that I'm not a traditional pharmacist, because I'm not a pharmacist that's just going to push meds and say, okay, take this medicine. But let me talk to you, and I want to hear what has changed in your life. Oh, okay, your spouse just passed. Yeah, you're going to naturally have some depression, or you just found out your husband had an affair, or you just lost this big promotion at work that you were aiming for. These are natural occurrences that will come, and God knows that we are flesh and blood.
Right.
If I'm not having a good day because, I just got in a big fight with my spouse, it's going to be a mentally provoking day. It's going to be a challenging day. But that's not to say that, okay, I need to now go to the doctor. I need to work up this entire plan of antidepressants and get this medicine, and I need this tranquilizer. But, you have to reason with yourself and understand yourself to know, okay, when something is not right and hasn't been right for more than 2 weeks, because clinically that's how they start saying with some of these mental disorders, more than 2 weeks, lasting consistency for more than 2 weeks.
Okay.
To say I might need help of something. And it might not mean help of medicine.
Right.
It might mean help of a psychiatrist, or help of a therapist, or really just help of a good spiritual group.
Right. Yeah, that I think that's what we're here. Our focus is to help all of us be able to see ourselves, but see ourselves in other people, and then you can figure out, okay, well, that worked for her. Maybe that's something I should try. Maybe I should just do the therapy. Maybe I do need to see my medical doctor to see if there's something chemically wrong. But I think that's interesting that you say more than 2 weeks, because a lot of times the people that I've interviewed that have any kind of more, I would say, serious mental health issues, it's stimulated or stem from their childhood. So it's not something that's just like an onset of like you said, something happened drastically. And then this is something that goes back to their childhood, that maybe it never was addressed, or it never was dealt with, or people just around us, sometimes don't understand that what we need or what we're missing. And I don't know, it just goes misdiagnosed, or just period. Not addressed.
Covered up by other things. So if you have a child that normally is very energetic,
right,
and then you start noticing that they're very solemn and isolated, that should be a trigger in your spirit to say, wait a minute, this is a child that's normally very energetic. We have to pay attention to those red flags. And I feel like as mothers, God give us like a seventh sense to know when something is off with one of our offspring. Something should go off, like, wait a minute. And like you say, it starts from childhood.
Right.
And I feel like as mothers, we have a lot on our shoulders, but God would have not given us those gifts as children if he did not believe that we could handle them. So when you say it starts from childhood, what about that childhood? And I'm not saying that every child is fortunate to be raised by their biological parents, but in that childhood, whether it was a counselor, a teacher, a pediatrician, an aunt, an uncle, one of those, I feel like every family have one of those very churchy aunt and uncles that, they can pick up on something or discern when something is off. And again, because somebody just brushed it under the rug and the mat, that is how these things linger for years and years and years. And then those 2 weeks of findings that you would normally point out when you go to a doctor to be evaluated, it turns into a post-traumatic stress disorder because it has lingered for so many years that now a person internally is overwhelmed with so many emotions of hurt, disappointment, pain, grief, so many things that, alone they won't be able to manage and triage out their life on a day-to-day basis and have peace and happiness and wholeness that we all should be able to have.
Right. But that's like something that people are digging for. If you have all these issues compiled on top of one another, it's like you're digging to get to that place where you do have peace. But how do you unpack all of that,
Layer by layer, sis.
Yeah.
Layer by layer.
Yeah.
Hey, I'm still unpacking.
Okay, all of us are still unpacking.
I'm still even unpacking things from a child. And, it's amazing because when I was seeing a counselor some years ago, back in 2017, I was a bystander in a drive-by shooting, leaving church.
Wow.
On a Sabbath. And it was on Australian Avenue. And I was a bystander, meaning that it was two cars that wedged me in and they were shooting at one another. And literally I was on the phone with my mom and it was like my voice began to stutter and slow down. And I was like, Mom, gun. And she was like, get down. And it's literally as I ducked in my car, the bullets just passed and springed me and blew out my windows. But I said that to say when I began to look at counseling, the counselor said, now, Kristina, just know at this time, a lot of the things that you may have not dealt with in your life up to this age, you're going to start to feel those emotions.
So was that your first time ever going to counseling after that?
Yes.
Wow.
In 2017, because I was becoming very hyper paranoid and very fearful. And see, like today I drove on Australian and didn't have any triggers, but on another day I might be on Australian driving and then I might have a trigger where if I see a dark Charger pull up next to me, immediately I'll quench.
Right. So, but through therapy, you learn how to
cope. They give you those coping mechanisms. And I still got Jesus. I love him down to my sanctified soul. He's a wonder.
Yes, he is.
But I feel like that wonder has provided for Luke to be a physician in the Bible. And God has also graced and anointed people on this earth to help us on our way.
Yeah.
To get to see him. And there's nothing wrong with that. I think the problem is when we don't have that balance, when you then become so reliant on that therapist that you're not doing your own self homework.
Right.
And you're putting your whole reliance on a pill or pills or therapy, and it becomes too much.
Or anything is that, and that's what it is. Like, we can't allow our mental illness to master us.
No.
That's one part of it. But then we can't become dependent on whatever that is as helping us not deal with the mental illness.
Right.
So we have to really, you've heard people say, like, get to the root of the thing. Get to the root of it, because if you don't deal with the root, then the fruit that you see come forth, it won't be right.
It won't be right. It's like you looking for apples and then oranges come up.
Yeah.
So, and we often wonder why so many of our men particularly are angry. And I try to think back to some of the generational strongholds that I see even exist in my family and even myself as a wife, as a mother. And then I say, well, when I try to understand, I say, well, you know what? When I think about it, we were oppressed as a color. We were oppressed as women to be professional and to rise above. And then you start having that compassion, like, okay, that's probably why, maybe my grandmother and my aunts sometimes act the way they do, or, you know, in that form, because all the things that they had to overcome just for me to be able to vote.
Right. Yeah, that's a whole nother story.
Yeah.
Yeah, that is a whole nother story, like generational.
Mm-hmm.
I just watched something on TV, like a girl, about 24 years old. She ended up getting murdered,
Oh, wow.
and her mother got murdered the same way. And so the first thing that clicks in my mind, like, is that generational, that the same way that your mother leaves, you leave, and that's why in prayer for me is always important to attack those places of generational curses, but also just generational, anything in the generation bloodline that is not of God. We want to cast that away, but also even looking forward as I think I'm kind of off subject right now, but even looking forward, when we look at generations that are coming before us in prayer, I don't know why I'm talking about prayer right now, but in prayer,
because you are a prayer warrior.
In prayer, you should pronounce those blessings upon your bloodline that's coming as well.
Generational blessings.
Generational blessings.
And see, that's how you turn things around.
Yes.
And even and I wanted to twist that right there, because even dealing with depression, every morning there is life and death in the power of the tongue.
Right.
The Bible speaks about it, that when we speak, we can speak life or death, and we eat that fruit. So although I may be a person that struggles with some of the, PMDD or PMS, depression, when I wake up in the morning, I may not feel like it, because serving God is not a feeling, but it's that faith that, okay, this is the day that the Lord has made.
Yeah.
And I'm going to be glad and rejoice that I'm beautiful, I'm fearfully, I'm wonderfully made, I'm a royal priesthood. And when you put those affirmations in the atmosphere, I feel like they carry you. Just as you were saying, you speaking blessings over your children.
Right.
I got to speak blessings on my life in the mirror, in the bathroom.
Right.
So I can set my day up, so when I meet someone, or if I'm dealing with my children, then I'm in the right frame of mind.
Right. And like you said, I remember that you did tell me about your diagnosis of PMDD.
Yeah, well, I won't say I have a medical diagnosis,
but you know what time it is.
But I know what time it is, because I can get very, very beyond moody. So
beyond, yeah, it's definitely not regular like PMS. It's like regular. It's on a whole nother level,
right?
But even dealing with that is. My thing is that we have to deal with it, and that you can't allow it to control you.
No.
And I have friends that are even diagnosed bipolar that have learned how to manage their mental illness.
That's a blessing.
Yeah, have really, but it's a very intentional walk. Is very intentional. Then that's what you're talking about. It's like waking up in the morning and speaking to myself in a mirror and saying, setting my day. This is how my day is going to be, because I'm fearfully and wonderfully made. Because this is the day that the Lord has made. I'm going to rejoice and be glad in it. So depression can't live here. You know, like that can't be here, because I'm not allowing it to be here.
Not going to
and you have to speak to your mind thoughts. Because we're talking about mental issues. So it's going on mentally. It's not always what is on your external, what is outside of you. It's what's on the inside of you. So you have to pull on what God has already placed on the inside of us, the Holy Spirit, and pull on those fruit of the Spirit, that they will be evident in our lives.
Yes, they have to be evident. I'm reminded of a famous preacher, pastor. He's now president of a conference, Adventist conference. But Dr. Carlton Bird, he says we may not be able to control the externals around us, but we can control the internal.
Right.
So those internal things that go on, that we have control over, our mind thoughts, how we set up our day. I mean, we might not be able to control the externals, the things that might happen in the run of the day, but that internal, as long as I have that internal vertical peace and standing with God, no matter how the day may go, because again, as mothers, our day can go from A to Z very shortly and very quickly, especially before school. But if I have that internal reserve, that base, that balance, that is the chemistry that keeps me grounded for the course of my day, that I can do what God wants me to do.
I just had a conversation about balance because, people will tell you, to be balanced. But our conversation was, is that balance is, I think it leans on a lot of being self-aware,
Amen.
because some people may say if you go too far left, then you're out of balance. But I think that sometimes there are places in your life where you not necessarily need to keep a balance, but you need to be self-aware when I need to tilt it that way, when I need to pour in this way, when I need to be poured into. I don't know if we'll ever be completely balanced.
Amen.
Because we all wear many hats.
Amen.
You know what I mean?
Amen.
And there's just different seasons and situations of our lives. But you do have to be self-aware.
Yes.
You have to be very conscious of who you are and what you feel like.
And growing old I'm not saying growing old like I'm old, but growing older
I was going to say, girl,
has allowed me to really understand that those are the moments in my life where I realize, wow, I'm really aging gracefully. Because in my 20s, you're not as self-aware when you're just out of balance,
right,
and out of control. And I'm not saying out of control like your life is just a complete wreck, but mentally
you're just going.
And now being in my 30s, my mid 30s, when I find myself just getting so out of line mentally and out of alignment, and my day is just passing me. And I said, ooh, Kristina, you got to get a hold of your day. And whether it be just stopping and going in the bathroom to have a prayer, or go on YouTube, play me a gospel song, something to just get myself back on course. And it's funny because sometimes we think, oh, I have to have this education or this level of literacy, but I deal with so many people every day that don't have higher education, and they know when they're getting ready to have a manic episode. They know they're calling the pharmacy, they're in panic. They're, please, if you can refill my prescription for my Xanax, please.
But they understand themselves.
They understand themselves. And it's crazy because, again, I talked about the internal, external. I have so many patients that around the holidays, they will tell me, if I do not feel my tranquilizer, diazepams, alprazolam, clonazepam, I won't be able to handle my in-laws.
Wow.
And I say to myself, the number of calls and people that come in the pharmacy because they say, I will not be able to cope with myself and deal with my mother-in-law or my sister-in-law if I don't have my medicine. Because it's such a stronghold. And isn't that's so sad to me, that it's almost like the in-laws who come in town for 3 days out the year, put them in bondage.
Send you over the edge.
Right. And the devil is a liar.
Right.
He is a liar, and the truth ain't in him. But again, we live in a society now. We live in a world where, almost anything goes. And if we don't have that armor on, and if we don't have that self-awareness that, hey, why am I going to let person XYZ trip me up mentally? My dad used to tell me as a young girl, Kristina, don't let anybody rent a room in your head for free.
Okay.
He used to tell me that all the time. Kristina, don't let anybody rent a room in it. Meaning, don't let anybody occupy or take away from the space and the peace of mind that you need.
Yes.
Because at the end of the day, people need to do what's best for them.
Right.
So I'm going to do what's best for me. And whether it be declining a phone call, whether it be not responding, blocking, I'm not saying blow people off. I'm never in the business of burning bridges, because you never know. We might have to go back and cross them bridges.
Right.
But you have to be, just like we're having this sit down talk. I'm looking at you eye to eye, you looking at me, and just letting people know where you are. Like, hey, this is where I'm at in my life. And, unfortunately, I'm sorry. I won't be able to do this with you. I won't be able to go out on these days of the week and drink or whatever it is your toxic behavior that takes you away from your peace of mind. Everybody's toxic behavior is not the same. But you know what it is that when you get it, you get loose.
Right.
And you get out of
Like
control.
it's going to be on.
It's going to be on.
Let's flip the script.
So
I seen this meme. It had,
yeah.
You remember that guy, Beetlejuice?
Yeah.
Yeah. He's like, it's time.
It's time. It's time.
Turn to a whole
It's
nother
time.
creature. Well, when you're talking about toxic behaviors, from a pharmacist's perspective, tell me how does, because some people are not getting prescription medication. A lot of people are using drugs, are using alcohol to medicate because they're trying to either dumb down that feeling or that emotion. Or sometimes I really believe a lot of people don't exactly know that there is a mental disorder or an issue there, so they do those things to kind of self-soothe, but they're not really aware that's what they're doing. But then you have some people that they are aware that that's what they know they have an issue. They're not using something that is prescribed by a doctor, but they're using weed or marijuana, alcohol to cope with those emotions that come up during those times. From a medical point of view, how does that work with our brain?
Well,
I know that's
how does it work with our brain is that what the brain wants and what we desire, we want that gratification. So naturally, as a human being, you want that satisfaction from what feels good and makes us feel good. But everything that looks good and everything that tastes good and feels good is not good for us. And I say that to now transition to say that I feel like the most toxic behaviors that we can have on people is that we are enabling them when we know that they have a problem. And we are in these dependent state of mind relationships with people. And then self-medicating is so toxic because you're self-medicating. And, and I digress a little bit, but even as physicians, it comes a very thin line when physicians begin to self-prescribe for themselves. So I've even had to address that when I see prescribers self-prescribing for themselves.
Oh, wow.
So
I see what you're saying.
Because
that's the same thing.
Yeah, you don't see yourself in the mirror.
Right.
I mean, if it was that simple, then what would be the need of a psychiatrist? What would be the need of a therapist, a counselor? I mean, it takes another person to look at us from the outside in to say, hey, you need some self-work.
Yeah.
And unfortunately, like I said, a lot of toxic behavior come from people know that they have loved ones. People know that they are in relationships with people that are in a bed of hell, and they are enabling them. They know that their children are on drugs, but yet they continue to enable them to give them these funds to blow through and buy more drugs. People know that they are in a relationship with somebody who is just so dependent on them and make them feel as if we're not together, I won't be able to cope. I'll just kill myself. Because I've heard that before. This person just suffocates me in a way where he controls me, or she controls me. And this person has that toxic behavior. If a person is telling you that without you, I cannot survive, or, that dependency is so stronghold that it's a bondage, no, that person needs some help.
So you're comparing self-medicating to any kind of dependency. So you depending on a person is the same thing. Like you're still feeding that. I don't know if it's an endorphin or some kind of
endorphins and dopamine, those positive serotonin releases of chemical through the brain. But what I mean by self-medicating is that instead of getting professional clinical help, you're relying on yourself. And again, if it was that easy, then we would all be on the up and up.
Right.
There would be no psych wards. Everybody would be just on the up and up, living in the fanciest houses and driving the best cars. And people wouldn't need all of these reality TV shows to tell us how to, conduct our lives and what's the real housewife look like. What's the real family look like. But I just feel like, I feel like God gives us all a nudge when something is not right.
That's what I was going to ask
And it
you.
does not take medicine. Come on. It does not take medicine. It's interesting. I have women that bring their husbands in all the time to the pharmacy. And I say it's because I operate more in the community pharmacy. So I feel like God talks to me there. That's my calling. That's my lane.
Okay.
But, and the wife will say, I just sense that something's not right with my husband, or I believe. And usually what I do now, being now an 8-year pharmacist, I'm still learning, but compared to first year, I'll tell them, what do you think it is? And they'll say, oh, I think it's because he played tennis the other day and stretched his arm out. Or I think it's because, he had a bag of them Takis and they didn't agree with him. Or, God gives someone in our hemisphere. I really, truly believe this, Tori, with all my heart. God gives everyone or someone who is in proximity to us, who has direct contact with us, a nudge when something is not right and something is off. And and you would be surprised, and I learned this a lot when I watch TV, that people say, oh my God, this person passes away. Oh my God, I knew something wasn't right.
Right.
Oh, I wish I would have said something. Oh my God, when they came to work that day. Oh my God. It's too late then when these mass shootings happen and these different acts of violence. And then you have the people that come on the news. Oh my God, I knew I should have said something. No, it's too late now. Why didn't you say, and I remember watching a few shows on Dateline where a child was abducted, and then the person says that they saw them like at a gas station, and the person will say, something wasn't right. Come on, you ain't got to be spiritual. I feel like that's not something that you got to be in relationship with God to get on the surface. God just will nudge you in your core like, something ain't right.
But I think it's like responding to the nudges. You know what I mean? It's the same thing with us, even those that are in relationship with God like that. Like, he could tell us something and we're not obedient, because that's what it is. That's what it is obedience. So just responding to the nudges of your life, that gut feeling, is not something that we always do. And I think that goes back, like I'm saying, about being self-aware. Not all the time do we trust our inner voice.
No, we don't. That's why we need people in our life that don't mind telling us when we're right and that don't mind telling us when we're wrong. And, I can't say it's that easy, because not all of us are fortunate to be in a space where, I might have my doctorate degree, but some of the ladies that keep me accountable, they may not even have a college education.
Right.
But I'm not looking at their level of book smart. I'm looking at the level of wisdom that they carry and the depth of who they are, that they can keep me accountable. Because I've had friend girls that keep me accountable and say, Kristina, you need to get it together. Check your attitude, girl.
Right.
And I even go far back as to when I had my first son, my older son. I call him my humbling son, because with him I went through postpartum depression. I went through suicidal thoughts. I went through a lot, but I call him my humbling son because fast forward to the day where I'm at now as a pharmacist in a beautiful home and car, and I look at him and God humbles me when I see him, because I know where God has brought me from. But I say that to say that when I had him, I was going through such heavy postpartum depression, and my mom was like, Kristina, are you okay? And my mom is just a direct person. She was in the military. So are you okay? Because something is not right with you, and people might not always package it how we need to hear it.
Right.
But just if you hear them from their place of love. So I knew that something was off with me. And I'm naturally a very energetic, happy person. But because I was just so overwhelmed with the baby blues, I was in a lot of heavy postpartum depression. And I was so close to giving thought to medicine. And before that, I was not a pharmacist 12 years ago.
Okay.
But I was giving thought to medicine, saying maybe I need help. But guess what? Really, all I needed was a spiritual support group, because what I did was I began to turn that pain into purpose. And what I did was I just became active in my church group. And then one morning I woke up. I never forget it. I think Jeremiah had to be like 1 year old or 11 months. And I didn't feel that weight. And I can't tell you the exact, and see, when I start talking about God sometimes, all that book smart go out the window now.
No,
I get down to it.
My last show, that's what she described depression as. Is she just kept saying it was a weight.
Every morning, throughout the day, and all I felt like I wanted to do was sleep, and I felt weighted, like a weight on me that set on me, that I couldn't smile, that I couldn't just enjoy life, enjoy my son. And I went through a painful breakup with his father, but I can't tell you the exact day or moment that it happened, but I do know the day that I woke up and I was like, I feel free.
Wow.
I felt free. And then when I look back now, and like I said, because I'm in the healthcare field and I'm educated, because, at the core, God doesn't make big eyes and little U's. Just because I got my doctorate degree, he don't love me more than another sister who's on drugs or on the street struggling.
Right.
It's just I'm more aware.
Right.
But I think about that was therapy. A prescription didn't do that. That was my prescription.
Yeah, we talked about that because therapy that actually gets you to change. And we would even say in the spirit realm, deliverance. Deliverance doesn't always come. It comes in different ways.
It does.
It can come through a conversation you're having with somebody.
Yeah.
It can come through the laying on of hands. It could come through prayer, but it can come through, like you're saying, you getting involved with something else that actually feeds that place, and all of a sudden you've been delivered. It lifts and it's gone, and so deliverance looks different for everybody.
It does, but it's not an overnight process.
No,
I still have to self-discipline and keep myself in check.
Okay. So as we're getting ready to close out, go ahead and finish talking about that, like those things that you do, because you mentioned like postpartum, you mentioned the PMDD. So what are some of the practices that you use to keep yourself lifted? Like
the things that I do.
What can we do to stay lifted?
Many things, because it's not just one thing.
Okay.
But it's many things, because, in my natural strength, I can't do anything.
Right.
It's all God. And even on my best attempts and highest pursuit, some days it just doesn't work out.
Yeah.
And it's just a bad day.
Yeah.
But on
bad
the days
happen.
Bad days happen. But the good thing is it's not the end of our story. But some of the things that I do is I'm a firm believer in affirmations.
Okay.
Affirmations. I like to speak to the atmosphere. When I walk into my job, when I open the door to the pharmacy, sometimes I say, okay, praise the Lord. I say, I'm here. And I say, now every demonic force flee right now in Jesus' name. And I just begin to walk the pharmacy. But affirmations is powerful for me. My grandmother always, as a young girl, used to tell me, Kristina, it's life and death in the power of the tongue. So that has always worked for me. Is speaking things, declaring things, prophesying things in the earth out of my mouth, saying, and then also cultivating an atmosphere of peace and worship.
Okay.
So I'm not saying that you got to be a singer to activate a atmosphere, but keep a song, a melody in your heart. And we're exposed to so many different music genres of inspiration. My level of inspiration might be gospel. Your level of inspiration might be Christian contemporary music or jazz, but whatever that is, again, that inspires you to want to be a different person. And when I say a different person, a better person.
A better person.
I'm not talking about the music that when you listen to it, you feel like you're ready to get lit and you go on the deep end. I'm talking about music that inspires me to be a better wife.
Or it makes you even feel good about yourself.
Yes. That lifts me from the caves of life, because caves of life come. I mean, you can prep and plan the night before and get things together, which is very necessary, staying organized. But I'm telling you, you can have your day set and then you get a call that will twist off your day, and then something will happen. You might get a tire, or just things happen in life. You might be in a tragic accident, or you might get word that someone just passed, or you might get report from lab work or from your doctor that, your health could have just turned that simple. But what I'm saying is, when we begin to cultivate an atmosphere around us, of peace, of cleanliness, of organization.
I'm glad you, I was like, I hope she go back to that. Because for me, like the atmosphere of worship, a clean house.
Oh, yeah?
Yeah.
I
I like chaos and clutter. Like I cannot. It does not allow the flow
Really?
to flow freely.
My husband is OCD.
Really? Oh, that's great.
He's OCD. He is OCD, and he tell me all the time. Now, I'm not saying I'm the neatest person, but I do like things clean and simple. But some people just are very OCD.
I would love that.
I have a grandmother like that.
OCD.
My grandmother is like that. But my husband is OCD. I mean, he organizes the organized thing.
But sometimes that is like we were talking about. That is a form of coping, a form of therapy. Me putting the things in place. Even like if I get upset about something, I clean the whole house because that is my way of I'm processing, I'm thinking, but I'm also setting the atmosphere that for clarity.
Yeah. Sometimes with that clarity, sometimes we have to pull away, and because we live in a high tech world, I know we always say, "Oh, sometimes write your prayers down." I'm a person in my cell phone. I have a text diary. So sometimes when I begin to feel overwhelmed, I'm a person, I do struggle with anxiety and tension. And I haven't openly shared this, but my husband knows this, that I do. And he's been so helpful. And he knows my triggers. And he'll say, "Kristina, you need to calm down." But I'll just take out my phone. And instead of getting on social media, I just begin to text a prayer on my little notepad in my cell phone. So sometimes we have to, and that was something I learned in therapy back in 2017, is the counselor was telling me sometimes you have to remove yourself from the situation that's causing the stress and the abrupt tension, and just recollect yourself mentally. So that has been very helpful for me. But listen, I sit here before you today, Tori, although God has blessed me in so many different ways and form, I'm still doing the self-work every single day of my life.
Yes.
And I say that humbly because, we can't get to a place in life where we feel like, oh, I have arrived. I've arrived. So I don't have to do no more self-work. I got this, I got that, I got the statuses, I got, and those type of people, that's not my circle.
Right.
I want people around me that are humble enough to know that, hey, I'm in need of a savior every single day of my life.
Every day.
Every day. Because guess what? If I don't, you might catch my timing off, and I might say something that might not be very kind or might not reflect Christ. So that's why it's important that, I surround myself around godly influences. Actually this morning I was on the phone with my prayer partner, and she covered me in prayer, because you need someone, and I'm not saying you need people that you just run and tell all your business to.
Right.
Because there are some things that are heart to heart that you tell God in prayer. But there are some people that God will kind of nudge you and say, okay, this is a safe place with them. And you can share some of your struggles and say, hey, I'm just really having a bad day coping mentally. And my friend girl was one of my accountability partners. And because recently I had a new baby, so of course all of this restructuring in my life, she'll say, "Kristina, if you can't call me, just send me an emoji of a praying hand." And she says, that's
enough to know.
That's to know that I need to intercede for you.
Yeah.
And that's a good friend. It's not always, okay, when I'm telling you I'm going through, what you going through about? Is everything okay? No, if I just say I'm going through, I need you to have some power, some oil that you can pray me through, that I can feel that peace. So those are the things that help me. Not helped, but helping.
Keep helping
me along my way.
Helping you along your way. Yes.
Helping me along my way.
Well, thank you so much, Dr. Kristina.
You're very welcome.
Lindo.
I feel honored.
I'm honored to have you. I mean, this is a great discussion, and I love to be able to let people see the human side and the spiritual side.
Amen.
And how it all works together, because we're not just spiritual and we're not just human. We're a combination of both. And, God does what he does.
He does what he does. And you, Tori, are just so beautiful.
Aww.
And you are so resilient.
Thank you.
I was thinking of you this morning, because I'm not sure if you remember, but back in when I was my first marriage, I tell people that was my first life. So back some years ago, I used to run into you at your uncle, or I think it was through marriage at the church on Broadway.
Easily.
Yes. So we didn't really talk, but I remember you then, and to see you now be so resilient with some of the trials that, you talk about, and you are okay with sharing, and just to bounce back. And I'm so proud of you.
Thank you.
Girl, hey.
The bounce back is real.
The bounce back is real, and you're glowing, and you look good.
Thank you.
I'm here to just encourage you as I encourage myself.
I appreciate that. Okay, you guys, it's Sit With Me. You can tune in every Tuesday. I may not be a therapist or a counselor, but I am bringing you top-notch people that are in the realm to be able to help us live better, live healthier, live happier together. Thank you for watching.